Good afternoon, everyone. Can everyone hear me?
Kindly raise the volume, Dr. Ryan.
How about that? Can anyone hear me now?
Yes.
It's better? Okay. So, good afternoon, everyone, and welcome to another Saturday exciting LAMP series webinar. It is our pleasure to welcome you to this short, brief, and quick webinar, which actually makes use of what we have to deal with on a day to day basis, especially here in the Philippines. So, our topic for today would be prostate problem, a quick and comprehensive approach. Just a reminder, if you have any questions, I would be your moderator. And then please, you can go ahead and put it in the chat box. And you can also unmute yourself. For the time being, during the presentation, can everybody please mute themselves unless they want to raise a question or something, okay? So prostate health, we know is the prostate only has one function, which is reproduction. So it's a production of semen for procreation. Dr. Hector de la Cruz will expound more on this. But what we actually know is that past the reproductive years, it becomes a problem for especially in males. And why? Because we've heard more cases of prostate cancer here in the Philippines. It is the third cause of cancer here among Filipino men. So your chance of getting prostate cancer may be affected by your age, especially if you're 50 and older. Race, it's common among African American and also Asian men. So if you have any family history, if your father or brother had prostate cancer, you're most likely to develop it too. So on the diet side, the risk of prostate cancer may be higher for men who eat high-fat diets. So as you can see, the World Health Organization published in 2020 that prostate cancer deaths in the Philippines reached 4,000 or 0.62% of total deaths. So in 2020, about 8,200 Filipino men were newly diagnosed. It is the third most common cancer in males. So that's death approximately about 17 deaths out of 100,000 population. So this will be expounded later, but if in case you have prostate problems, you mostly experience frequent urge to urinate, the need to get up many times during the night to urinate, blood in the urine or semen, pain or burning sensation, painful ejaculation, frequent pain or stiffness in lower back, hips, pelvic and rectal area, and also dribbling of urine. I will be posting my sources here in the chat box, and I welcome with open arms and a lot of respect and also a lot of accolades to our presenter tonight, Dr. Hector de la Cruz.
Thank you very much, Dr. Ryan. Can we get down to business? Okay. Okay, I hope everybody was having fun. Those who have joined us since day one of our LAMP lecture series. The objective is actually to make everything sound simple as long as you understand the principles. So maybe towards the end of the session, we will try to evaluate how far or how good we have become as a practitioner. Okay, so let's start. So our topic is about prostate issues, and we shall try our best to present it in a very comprehensive as possible, or as quick as possible. Our objectives today are we need to differentiate between a healthy prostate and enlarged prostate. What are the types of prostatitis? Why is it that everybody is so concerned about prostate cancer? And did you know that prostate cancer is the third most common cancer in the Philippines among males, following colorectal and lung CA? And then we need to also study chronic prostatitis in Chinese medicine. And of course, our differential diagnosis using our pattern weaving, the acupuncture treatment, and tips for prostate health. The prostate is a gland that surrounds the urethra, as you can see on the slide. And this is located in front of the rectum below the bladder. And how big is the size of a healthy prostate? It has the size and shape of a chestnut, and it plays a vital role in the male reproductive system. Its purpose is to produce and release a fluid that makes up a significant portion of the seminal fluid. Now, the remaining fluid is produced by the seminal vesicles. These fluids combine. They will transport sperm through the urethra. This is the same tube that passes the urine during ejaculation and are meant to neutralize the vagina's naturally acidic environment, making it easier for fertilization to occur as it ensures the sperm's survival. Without the prostate, fertility is lost and erectile dysfunction is common. Now, let's talk about the mechanism. Why is it that the prostate enlarges? As a man ages, his prostate naturally enlarges due to an increase in a hormone called prolactin. As a result, a chain reaction occurs. There will now be an increase in an enzyme known as 5-alpha reductase, and this will lead to an increase in testosterone metabolism, followed by an increase in DHT, or dihydrotestosterone, which is a metabolic byproduct. Now, the DHT is the one that stimulates the prostate cells to multiply, eventually leading to prostate enlargement. And this process starts at around age 40, and at least 50% of men at age 60 are affected by BPH. 80% of men age 80 suffer from this condition. Though benign, it negatively impacts the quality of life and increases the risk of developing prostate cancer. Prostatitis is inflammation of the prostate, and this may involve considerable pain. In contrast, BPH, or benign prostatic hyperplasia, may not involve any pain at all. Prostatitis is fairly common in adult males, and it has been classified into 4 types. We have acute bacterial prostatitis. So if we have acute, we also have chronic bacterial prostatitis. Then we have the non-bacterial prostatitis and prostatodynia, in which there is pain in the prostate, but there is no active infection. Only 5% of all cases consist of either acute or chronic bacterial prostatitis. Non-bacterial prostatitis comprises 64% of cases, and prostatodynia makes up another 31%. So this is a challenge for us practitioners, okay? Bacterial prostatitis is a relapsing infection that is difficult to treat. And how is the presentation? So if it's bacterial, there is an infection. So it presents with perineal pain, recurrent epididymoarchitis, and prostatic tenderness. And usually you will have a pus when you try to express the prostate secretion. Treatment is long-term. We usually give 4 to 6 weeks treatment on trimethoprim, ciprofloxacin, ceftriaxone, and long-term low-dose treatment is required. Acute bacterial prostatitis is the result of bacterial infection, and the culprit is called E. coli. And as with any other infection, it typically begins with the fever, chills, and other symptoms that bacterial infections bring on. And the typical presentation of someone with acute bacterial prostatitis is that he will complain of lower back pain, and there is pain in the area between the scrotum and the anus. There is difficult or painful urination and the increased frequency of urination. Acute prostatitis is most commonly found in young sexually active men, and this may be the source of infection, especially if there are many different sexual partners. Treatment includes antibiotics and is usually effective. Now let's go to chronic bacterial prostatitis. This is related to failed treatment of acute prostatitis, or it may develop on its own. In some cases, we have atypical microorganisms, which are called mycobacteria, or non-bacterial species. Could be fungi or viruses. May be isolated. It involves frequently recurrent low-level infections of the prostate, which usually involve the same strain of bacteria. Symptoms will include frequent and painful urination as well, and nocturia. That means you keep on urinating at night. And stones, or what we call the calculi, made up of urinary components, are often found in the prostatic ducts. And this implies a reflux of urine into these areas. And antibiotics fail as a treatment in cases of chronic prostatitis because they cannot eliminate the bacteria that are found in the stones. Hence, there is a constant source for reinfection present. Another factor often found is lack of zinc in prostatic fluid. Now, prostatic fluid is continuously released and contains a potent antibacterial factor, which includes free zinc as the most active ingredient. Men with low levels of zinc in their prostatic fluid seem especially prone to chronic prostatitis. So the diagnosis of prostatitis is primarily based on urine cultures after prostatic massage to increase sensitivity. Next is non-bacterial prostatitis. This is the most common of all prostatic conditions. And as the name implies, there is inflammation. So there is increased inflammatory cells in the prostate. And the resulting inflammation actually resembles that found in chronic bacterial prostatitis. But as the name implies, there is no history of infection, nor would you find any bacteria in your culture. Along with the symptoms found in bacterial infections, the patient would complain of post-ejaculatory pain and discomfort. So this is very typical of non-bacterial prostatitis. The male would always complain of pain after or during or even after ejaculation. Conventional medical treatments do not yield good results. Some men with non-bacterial prostatitis, they report frequent urination and others do not. So they're not the same. Okay, the symptoms are actually varied. Some would report sexual dysfunction and erectile difficulties, others do not. Generally, when cultures are negative, so we would think that this is a chronic non-bacterial prostatitis. This can be described as persistent relapsing pain or discomfort in any of the following areas: in the urethra, perineum, tip of the penis, which is not related to urination. So that means even if the man does not urinate, the pain is still there on the tip of the penis. Or there would be pain in the hypogastrium, in the testicles. There could be pain or burning during urination, pain or discomfort during or after ejaculation, pain in the lower back and upper legs, pain in the groin and above the bladder, burning high up in the urethra, a sensation of not emptying the bladder completely after finishing urinating, lowering of libido. There could be fatigue, or the semen could be discolored. The color would be yellowish. So this is due to the fact the color is coming from the dead white blood cells, which is a sign of inflammation. The pain after ejaculation will last from hours to days. There will be impaired memory, difficulty concentrating, and painful lymph nodes. Now, the condition waxes and wanes. The pain can recede for hours or even days, then return inexplicably with force. There are also people who experience remission, which can last months to years, then have another flare-up. Now, let's go to chronic prostatitis. How do we define it? So we define chronic prostatitis as having pain or discomfort in the pelvic region for 3 months or more. It affects younger men, younger than those with BPH. So the median age is 43 years. And the most severe symptom is pain. This is the most commonly reported symptom. The symptoms are episodic and they wax and wane with variable periodicity. The most common site of pain is the perineum, but many places throughout the pelvic region are reported as uncomfortable. There will be voiding symptoms, irritative symptoms. They contribute more than obstructive symptoms. Sexual function impairment, although most men are potent. Pain after ejaculation is a very specific complaint, and this is the one that distinguishes prostatitis from BPH. Okay, so if there is pain after ejaculation, that's definitely prostatitis. Now let's go to prostatodynia. This is the this is prostatic pain in the absence of active infection. So there's no infection. This may be a very persistent sequel to bacterial prostatitis. Prostatodynia, which is most common in young and middle-aged men, presents many symptoms similar to chronic prostatitis, but unlike chronic prostatitis, it lacks the excessive number of inflammatory cells. So there's not too much inflammatory cells. The symptoms are similar, okay? There is pain and or discomfort in the groin, perineum, testicles, lower back, and penis, which are due to the smooth muscle spasms in the prostatic portion of the urethra and in the neck of the bladder. Now, this subsequent reflux of urine into the prostatic and ejaculatory ducts causes a chemically induced inflammation. So the one causing the inflammation, which is chemically induced, is actually the reflux, okay, into the ducts. Fatigue in the muscles, in the pelvic region, and emotional stress are powerful contributory factors in prostatodynia. Prostatitis accounts for 25% of all office visits made to urological clinics, and its effective treatment remains a challenge. As many as 35 to 50% of men are affected by symptoms suggestive of prostatitis during their lifetime, and the actual prevalence is approximately 8%. Chronic prostatitis appears to contribute to the onset of prostatic cancer through the activation of many different mechanisms. Globally, prostate cancer is the most commonly diagnosed cancer in men, with approximately 1.4 million diagnosed in 2020. In the world, it is the fourth most commonly diagnosed cancer. And in the Philippines, it's number 3 among men, following colorectal and lung cancers. In 2020, there were about 8,000 men who were diagnosed with prostate cancer. Survival for all stages of prostate cancer. Here's the good news. More than 85% will survive for 5 years or more, and almost 80% will survive for 10 years or more. Okay? Now, environment and diet appear to be primary causative factors. The symptoms of prostate cancer can be very similar to BPH or to the 4 forms of prostatitis. Often, prostate cancer gives rise to no symptoms at all. The patient is asymptomatic. The PSA, or the prostatic specific antigen test, gives rise to many false positive and false negative results. So this is not very reliable. Now let's talk about chronic prostatitis in Chinese medicine. From the perspective of Chinese medicine, prostatitis may fall under the heading of several different conditions. Spermaturia is characterized primarily by involuntary discharge of sperm, even though in prostatitis there may not be a spermatic discharge. Essence turbidity is characterized by a turbid, sticky urethral discharge. Itching and pain of the penis that may feel like a burning blade, and dark yellow urine. White turbidity is characterized by turbid urine, a turbid white urethral discharge, and dysuria. Now, the essential aspect of the pathology of prostatitis is that there is a pathology not only of fluids, but also of essence, or the jing. It is interesting that although the ancient Chinese did not have knowledge of the prostate and seminal vesicles, they were aware of the difference between urethral discharges of urine and of sperm. Okay, so urethral discharges of urine pertain to the pathology of urinary syndrome and therefore to body fluids. By contrast, urethral discharges of sperm pertain to the pathology of essence and are generally due to a weakness of the sperm gate. There are 2 main etiological factors of prostatitis. Number one is poor genital hygiene, leading to damp heat. Okay, so those men with poor genital hygiene can eventually get damp heat. And excessive sexual activity will give you essence stasis or stasis of essence. And the dump heat frequently leads to the formation of toxic heat. So diagnosis by prostate exam. If the prostate feels small, it is kidney yin deficiency. If the prostate feels large, that's dampness and or phlegm. If the prostate feels hard, there's blood stasis or cancer. When treating prostate patterns, it is important to treat one of the three extraordinary vessels that flow through the prostate: the governing vessel, conception vessel, and the penetrating or chong mai. The governing vessel is selected when there is a pronounced kidney yang deficiency. The conception vessel is selected if there is a pronounced kidney yin deficiency, and the penetrating vessel if there is pronounced blood stasis. In all cases, we use the opening and coupled points of the relevant extraordinary vessel. So in men, we use the opening point on the left side and the coupled point on the right. For example, for governing vessel, if you have prostate cancer, if you have kidney yang deficiency, we needle SI3 on the left and bladder 62 on the right. So these are the main points for governing vessel, for conception vessel or renmai, for the penetrating vessel or chongmai, the liver channel, Bakshu points, dump heat points for blood stasis. You also have to use the points for stasis of essence. And do not forget REN1, because this is particularly important for chronic prostatitis, because it is the meeting point of the governing, the renmai or the conception vessel, and the penetrating or chunk vessel, as they all emerge at this point, REN1. So don't forget to needle that. So let's get to know the points. So for the governing vessel, if you have a patient with kidney yang deficiency, so you need to needle SI3 on the left, bladder 62 on the right, and do 3. Okay, so if we have here the corresponding ear equivalent for the point, which is my favorite. SI3 is tonification point, shoestring point. It is also the opening point of the governing vessel. When you use this with bladder 62, it affects the dumai and thus the spine, the lower back, and kidneys, and helps invigorate the mental faculties. Bladder 62 is called the calm sleep point. This is the coupled point of dumai. It is also called the ghost point. This has a powerful energizing effect on a deficient kidney. It has a direct effect on the endocrine system. Do3 tonifies the kidneys. It helps bring strength and flexibility to the spine and can be considered for lower back pain. And this point, Do3, is very useful for patients who cannot bend from the knees, those who have arthritis or rheumatism in the lower limbs, or those with cold feet in kidney yang deficiency. Moxa used here warms through to the abdomen and the lower jaw, and it is helpful for fear around sexual intimacy or for male sexual weakness. Now let's go to conception vessel. The points are, so we use the conception vessel when the diagnosis is kidney yin deficiency. Lung 7 on the left, kidney 6 on the right, REN1, REN2, REN3, REN8. So this is lung 7, luo connecting point, opening point of the renmai, Madanyang heavenly star point, Kawu command point of the occiput, and exit point. This important point is similar in effect to spleen 21, as it is said to be a special luo connecting point which affects all junction points. Lung 7 helps maintain the rhythm and balance amongst all the other zangfu. Kidney 6 is the coupled point of renmai. This is called the joyous sleep point, and this is a very important point for strengthening the kidney yin. REN1 or CV1 is an entry point, the general junction or general luo point, ghost point. This is called the master point of the whole body. This point can actually resuscitate and tonify the patient. This is also good for hemorrhoids and painful disorders of the penis. Particularly important for chronic prostatitis because, as we've said earlier, it is a meeting point of the three extraordinary vessels: governing, conception, and the penetrating vessels. REN2 is the crossing point of renmai and liver. This point can do all that REN1 can do, except resuscitation. We consider this for problems with lack of virility. REN3 is the alarm point of the bladder. It affects the endocrine system along with REN4 to 6. It energizes the patient's yin aspect at a deep level. REN8 can bring a deep, nourishing, and revitalizing warmth to the spirit of a person who is exhausted, depleted, or weakened at a deep level. As always, this is always forbidden to needle. So you have to use the ear point instead. Now let's go to the penetrating vessel for blood stasis. We use spleen 4 on the left, pericardium 6 on the right, and kidney 14. Spleen 4 is a luo point of the spleen. It is the opening point of Chong Mai, one of the most beautiful and powerful points in the body. We consider using spleen 4 where a patient has long-standing lethargy and weakness, and it actually helps circulation in the legs. Pericardium 6 is the coupled point of Chong Mai. It is also called a general luo point. It is the perfect love point, broken heart gate, gate to success, conserver of yin. And this connects to the inner aspect of a person. Kidney 14 is the crossing point of the kidney and Chong Mai. This is for warmth on the mental level. Now, do not forget to needle the liver channel consisting of liver 5, liver 1, and liver 3. Let's start with liver 5. This is the luo connecting point of the liver. It's called the master of blood. It connects to the genitals. And this is very helpful when someone has premature ejaculation, sterility, or genital itching. Liver 1 is Wood Point, Horary Point from 1 to 3 a.m., Jingwell Point. This can produce a great surge of energy at the start of the meridian, or it can strongly calm, particularly effective between 1 to 3 p.m. This is good for hernias, enlarged scrotum, pain in the penis, and testicles. Liver 3 is called a Yuan Source Point, the Earth Point, Shoestring Point, Total Relaxation Point, Madan Yang Heavenly Star Point, Independent Point for spasms. Its alternative name of Happy Calm describes its effect well. Now, the back shoe points are bladder 32 and bladder 34. Bladder 32 is the crossing point of bladder and gallbladder. We use this point for difficult urination because it strengthens the kidneys, the lumbar area, and the knees. Bladder 34 is the crossing point of the bladder and the gallbladder. It eases also difficult urination and elimination, strengthens the lumbar area, tonifies kidneys, and affects the lower jaw. Consider doing moxa on bladder 34. Now let's go to damp heat. You have to use REN3, stomach 28, spleen 9, bladder 22. So REN3 is the alarm point of the bladder. It has a grounding and stabilizing effect on the lower jaw. This is good for chronic or acute bladder or urinary problems, impotence, or where the body is generally weak and fatigued. We use also stomach 28 to help regulate fluids in the lower jaw, and we can use this point for retention of urine, lower abdominal distension. Spleen 9 is a water point and a Hussey point. The presence of excessive dump can not only cause edema of the legs or abdomen, retention of urine, or diarrhea, but it can also result in making you mentally bogged down or woolly-headed. Bladder 22 is the backshoe point of the triple burner. Triple burner helps keep open the water passages. This is for retention of urine or swelling in the lower half of the body. Now for blood stasis, liver 3 again, then spleen 10, bladder 17, and kidney 14. So this is liver 3. We've discussed this earlier. Spleen 10, we consider this for anything associated with the blood itself. It revitalizes and nourishes it. So we use spleen 10 for poor circulation, lack of energy, and those with cold extremities. Bladder 17 is the backshoe point of the diaphragm, the influential point of the blood. We consider for blood deficiency problems. It invigorates the blood, so it makes the blood move, helpful when the patient is cold, weak, or sad. Moxa can be very effective here. Now for stasis of essence, we use kidney 14 and REN 5. So this is kidney 14, we've discussed this earlier, and this is REN 5, the main alarm point of the triple burner. This is the main center of energy, and it is good for chronic lack of vitality, lack of energy, tonifies kidneys, and thus the yuan qi. Okay. you may have to use a lot of moxa if you decide to use moxa, because especially if this area is stone cold. Now, these are the patterns that we will be discussing for the Chinese medicine approach. Dump heat in the lower burner, dump heat with toxic heat in the lower burner, Qi stagnation, blood stasis, stasis of essence, stasis in blood connecting channels, kidney Qi deficiency with dampness, kidney yang and liver blood deficiency, kidney yin deficiency, dump heat and turbidity in lower burner, kidney essence deficiency, heart and kidney deficiency. I would like everyone to participate in finding out why the diagnosis is so. For example, if you have a patient whose diagnosis is dump heat in the lower burner, who would like to volunteer? Okay, what makes the diagnosis dump heat in the lower burner? So, let's look at the evidence or the manifestation of the dampness and the heat. As you can see, there's sticky yellow urethral discharge. The tongue is red, so that's definitely heat. There's a sticky yellow coating on the root, so lower burner, damp. The pulse is slippery rapid. So treatment principle, clear heat and resolve dampness. So these are the points. We've discussed this earlier. So we have points that resolve dampness and points, local points that can affect the prostate. And of course, the very popular Li11 to clear heat. Next pattern is dump heat with toxic heat in the lower burner. So this time we have a situation in which the dump heat has leveled up to toxic heat or worsened to toxic heat. So if it's toxic heat, then you will definitely look at the tongue. As you can see, the tongue is, it has red spots. Of course, the tongue is red and swollen. And so treatment principle would be to resolve damp heat and toxic heat, invigorate blood, eliminate stasis. So we use the following points. So we use points to invigorate blood, to affect the prostate, and to resolve dampness from the lower burner. The third pattern is Qi stagnation, blood stasis, stasis of essence, stasis in blood connecting channels. So you see a lot of the word stasis here. So definitely expect to see a purple tongue, okay? So sticky yellow coating on the root with red spots, and there's dribbling after urination. This is a feeling where you haven't emptied your bladder after you peed, okay? So the treatment principle, we move the Qi, invigorate blood and essence, remove obstructions from connecting channels. So we use points to invigorate blood and essence, to affect the prostate, and to resolve dampness. Number 4 pattern is kidney Qi deficiency with dampness. So you have here a tongue that looks pale with a sticky coating. And the evidence of kidney Qi deficiency here would be dull ache in the genitals, dull ache, Qi, that's very Qi deficiency, radiating to the groin. And of course, all those urinary issues. Pulse saggy. So treatment principle, tonify and warm kidneys and spleen, resolve dampness. So we use points to tonify the kidney yang, to resolve dampness, to affect the prostate, and to tonify the spleen. Pattern number 5 is kidney yang and liver blood deficiency. So why is this called, why is there liver blood deficiency? Because there is cold legs is a manifestation of both kidney yang and liver blood deficiency, right? And the tongue is pale, pulse weak and deep. So we tonify and warm the kidney yang, nourish the liver blood. So we use points that tonify the kidneys, nourish the liver blood, resolve dampness, and local points to affect the prostate. Number 6 is kidney yin deficiency. Everyone is familiar with yin deficiency? Tongue without coating. So if there is empty heat, the tongue is red, okay? And the pulse is floating empty, and it's rapid if there is empty heat. Of course, we have the classic signs of 5-pound heat, night sweating, dizziness, tinnitus. So we nourish the kidney yin, resolve the dampness. So definitely we'll be using points to nourish the yin, tonify the kidneys, resolve dampness, and of course, local points to affect the prostate. Pattern number 7. Damp heat and turbidity in lower burner, kidney essence deficiency. So when you have decreased memory, that speaks a lot about the kidney essence. Okay? Nocturnal emissions, and of course the discharge, the one in italics. Excuse me, turbid white urethral discharge. So the tongue is pale, pulse is weak and choppy. So treatment principle, we consolidate kidney essence, resolve dampness, eliminate turbidity. So our points are those that tonify the kidneys and consolidate the essence, and then resolve dampness and eliminate turbidity. And finally, the last one, this is very common. Not too many people know that they have heart and kidney deficiency, because all you can see is that the tongue is pale. But they don't realize that being able to hear your heartbeat is already not normal. So that's there's palpitations, there's tinnitus, insomnia, tiredness, premature ejaculation. So we tonify kidney yang, obviously, tonify heart chi, nourish heart blood, promote the descending of heart chi. So we use points that will treat both the kidneys and the heart, because they arise from the space between the kidneys and it flows through the heart. And we use points that tonify the kidneys. We use points that nourish the heart blood and promote the descending of heart chi, and local points to affect the prostate. Now, finally, we go to the diet for prostate health. Now, the new trend now is that nutritionists or the experts, instead of focusing on specific foods, dietitians, physicians, and researchers they came up with an overall pattern of healthy eating. And healthy eating is healthful fats, no? Like olive oil. Okay, let's take a look at this one. You have to eat at least 5 servings of fruits and vegetables every day. You go for those with deep, bright color. Deep and bright. Choose whole grain bread. Don't eat white bread. And choose whole grain pasta and cereals. Whole grain. Limit your consumption of red meat, including beef, pork, lamb, goat, processed meat such as bologna and hot dogs. So you have to eat more fish, skinless poultry, beans, and eggs are healthier sources of protein. You have to use olive oil for your salads. You have to eat nuts. We didn't mention peanuts here, but you have to eat almonds, walnuts, or pecans. And the famous avocados. Limit saturated fats from dairy and other animal products. Avoid partially hydrogenated fats, which are the trans fats. And I don't know if you're aware already, these are found in many fast foods and packaged foods. Avoid sugar-sweetened drinks like sodas and many actually all fruit juices. Eat sweets as an occasional treat. So maybe you can do it like once a week or twice a week. Don't be too miserable. Okay, cut down on salt. Choose foods low in sodium by reading and comparing food labels. And limit the use of canned, processed, and frozen foods. Watch portion sizes. Eat slowly and stop eating when full. Okay? And try not to put too much salt, because we only need 1.5 grams of salt a day. And 1 teaspoon of salt is actually 2.4 grams. So that gives you an idea now. In addition to eating a healthy diet, you should stay active. Regular exercise pares down your risk of developing some deadly problems, including heart disease, stroke, and certain types of cancer. And although relatively few studies have directly assessed the impact of exercise on prostate health, those that have been done have concluded for the most part that exercise is beneficial. And they found out that men who were more physically active were less likely to suffer from BPH. Even low to moderate intensity physical activities such as walking leisurely or walking regularly at moderate pace yielded benefits. Okay. And men who ran for an hour and a half or did 3 hours of rigorous outdoor work per week were 20% less likely to develop ED than those who did exercise at all. More physical activity conferred a greater benefit. Okay. So again, for Chinese, for the TCM concept, these are the foods fit to eat. Drink more water. Make sure it's not cold. Foods rich in protein, vitamin A, C, and E. Foods rich in iron, zinc, and selenium. And try to eat carb, fruits, and sesame. Avoid liquor and tobacco. Avoid spicy foods. Avoid oily and strong flavor foods. Okay, these are the foods that might harm you. Green Chinese onion, it's a no-no. Onion and ham. So to summarize, take a look at this one. You may take a screenshot, no? Eat a healthy diet, avoid high-fat dairy products, spicy foods or caffeine, wear comfortable clothes, um, do some exercises that strengthen your pelvic floor muscles, drink plenty of water, choose your herbal supplements carefully, go to a very good practitioner, make cardio a priority. Manage your stress level, bawal na magalit. Avoid saunas or hot tubs, and limit your sodium intake. Now, I am going to show you a patient that I had. Okay, wag na lang. Okay, I'd like you to see the tongue. Who would like to diagnose? Any volunteer? No volunteer. Okay, what is your diagnosis here? This is a 66-year-old male diagnosed with prostate cancer. And the good news here is that we don't die too fast, no? Anyone would like to comment, please? What is this? Any volunteer? What is the color of the tongue? This was the first visit. Ako wala na. Okay, sige. It's a very swollen tongue, right? So it's very young deficient. It's actually there's a lot of phlegm, but this is very dampness. And when you look under the tongue, do you see any issue there? Okay, if you look closely on the right side, there's some tortuosity there. Actually, the patient is diabetic for the last 20 years, but still eat the food that he loves. Okay. After the first visit, this is what happened to the tongue. Okay. Thank you very much for your attention. So if you want to comment, let's discuss it later. I just would like to, excuse me, for those who are into auriculotherapy, this is what I notice about the ear. Do you notice any strange thing here? For
Common
men,
thing.
yeah. Anyone would like to? This is the ear of the patient, 66. Of course, we cannot show the face. I no comment. Okay, sige. So maybe we can get some comment later. Thank you very much for your time. Okay, Dr. Ryan?
Thank you, everyone, for your time. I also would like to say that I forgot to mention earlier that it is almost impossible for a man to check their own prostate. So you actually need to see your practitioner or a nurse to do that for you. Second thing is that whenever we have bacterial prostatitis, it's also important to support TCM as a complementary approach for your antibiotics, because you will definitely need your antibiotics to get rid of the bacteria. So I just wanted to add that. It's a most common question that I often receive whenever I see my patients before. One thing I also would like to add is that sometimes we take for granted, but for men over 50 for prostate health, it is also recommended to go ahead and just check your PSA,
Yes,
a
eh.
prostatic serum antigen. It's a very simple blood test. You don't have to what do you call this, fast for that test. But you can ask your physician, especially if you're experiencing any of the symptoms, or even if you're not experiencing any symptoms at all. It's just we've learned that an ounce of prevention, it's always
True.
worth a pound of cure. So on preventative health nowadays, especially with the food that we eat, we really need to be 10 steps ahead when it comes to our health. So have your prostatic serum antigen checked, and also always have your prostate checked when you're 50 and above.
Yeah, and most cases of prostate cancer, you don't have any symptoms.
Mhm.
Yeah. You would rather have if you had issues about like if you have pain after ejaculation, if you are sexually active, I think that's a better better concern than the prostate cancer. So again, earlier, if you were listening, when you talk about prostate cancer, it's always the environment and the diet.
Mhm.
So the good news here is you don't die immediately from prostate cancer. Um, like 85% would still live another 10 years. So it's not too late to change.
And especially if we have what you call a benign prostatic hypertrophy, meaning to say it's non-cancerous, but your prostate is already enlarged.
Yes.
So, once it's detected earlier, it can be monitored to prevent prostatic cancer. Because if if it turns out to be cancer, it could metastasize, meaning to say it will travel from the origin, which is your prostate, into other parts of the body. So, always be watchful and always be ahead of yourself, especially when it comes to your health.
Yeah. And as practitioners, we should be aware that in Chinese medicine, um, you need to be very familiar with the patterns. And earlier we presented the points. Of course, before you use the points, you need to understand what am I dealing with. Okay. So if there are only three things that you have to remember. If if your patient has an obvious sign of kidney yang deficiency, then you should focus on using the governing vessel, and we have the points to do that. If your patient is kidney yang deficient, then the conception vessel. We also mentioned the points. And if your patient has blood stasis, the cancer, asymptomatic, but the tongue is purple, so you need to use those points. Okay. Actually, we know of someone. I cannot mention the name. He's a very... I'll take a look kung nandito siya ha. Pero wala yata. Okay. Diba? So that's a good news. We can still live a quality life. And this is not just about needling. It's also about your lifestyle, changing the way you eat, changing. You can still eat the food that you love, but you just need to make some modifications. You can still enjoy your sweets, but don't be too sweet. Okay, any questions from the floor?
I do not see any question in the chat box. So at this point, I would like to ask, from the previous couple of weeks that we had this quick webinars and quick learning moments, does anyone have anything to share that they actually were able to encounter a patient with lower back pain or shoulder pain?
Nagamit nyo ba? Huwag na kayo matago. Okay, Sir June, would you like to share? Ay, wala. Okay. So anyway, it just means that probably They have nothing more to ask? Okay. We presume that you are already good at tongue diagnosis. As you can see from the patterns, it's the tongue and the pulse that will give the pattern away. Diba? Sometimes the symptoms are so vague, you get confused. But what will clinch your diagnosis would be the tongue, particularly. Yes, the tongue. Okay, so again, um, ano ba? Dr. Ryan made mention about the symptoms. Of course, the most common complaint would be pain um, after having sex, all these things, and then the usual thing that we do is, of course, we go to a urologist. He would request for some blood counts and also your PSA, of course. So as mentioned by Dr. Ryan, if you're 50 and above, actually it should be 40 or mid 40s. Yeah. So if you were listening earlier, at age 40, this is the time where your um your cells multiply. That's why your prostate cells multiply as triggered by the DHT, dihydrotestosterone. Okay? Yon. Okay, so if there are no questions, I think so. I'd like to thank everyone for joining, and we hope you could join us again. We have no webinar next week because of the holidays. We're going to resume on April 6th. The topic will be hip pain. This time, hip pain. You know, hip. Hip is balakang, no,
Yes.
in Tagalog.
Cintuda in Spanish.
Ah, wow. Okay. Wala talaga. Okay, so with that, thank you everyone.
Thank you everyone for joining and an observance of Holy Week next week. I wish everyone also a happy Easter and a good week-long celebration.
Thank you,
Thank you.
everyone.
Yun po.
I hope everything is clear. Bye-bye. Thank you.